It's my pleasure to introduce Riley, a senior healthcare qualitative research moderator with over 7 years of experience in pharmaceutical market research. Riley specializes in high-impact qualitative studies across therapeutic areas such as oncology, cardiometabolic diseases, and immunology. She has conducted extensive ideas and focus groups with physicians, KOLs, patients, and payers, covering everything from product positioning and unmet needs to concept testing and patient journey mapping. What really sets Riley apart, though, is her balance of rigorous preparation and genuine rapport building. She's able to quickly get up to speed on complex disease areas while creating a comfortable space where stakeholders feel safe sharing candid, clinically nuanced perspectives. And in healthcare research, that combination truly makes a difference. We're really excited to have her with us today. So Riley, healthcare moderation can be quite unique. What would you say sets it apart?
That's a great question. I think what really makes healthcare moderation different is the level of knowledge you're expected to bring into the room. You have to cross quite a high knowledge threshold, whether that's understanding disease mechanisms, treatment pathways, clinical guidelines, because your audience absolutely will notice if you're not prepared. At the same time, you're engaging very different stakeholders, physicians, patients, KOLs, payers, and each group requires a slightly different trust building approach. You can't moderate them all in the same way. And of course, ethical compliance is non-negotiable in healthcare research. There's very little room for ambiguity. I'd say the core distinction is this. With physicians especially, credibility doesn't come from being personable, it comes from professional preparation. When they see that you truly understand their clinical reality, they open up. That's when you can really unpack their decision-making logic within the proper clinical context and generate insights that are not just interesting, but strategically meaningful.
In your experience, what tends to be the most challenging aspect of moderating physicians?
I'd say the biggest challenge is that physicians naturally scrutinize anyone outside their field. They're assessing your credibility from the very beginning. If you don't show a real understanding of the disease landscape and their clinical dilemmas, they'll stick to textbook answers. And once that happens, it's very hard to uncover what truly drives their prescribing decisions or where the real unmet needs are.
If you had to pick just one, what's the one skill every great moderator absolutely needs?
If I had to choose one skill, I'd say it's the ability to manage time under pressure. In a typical 16-minute interview, you need to smoothly guide the full journey from building rapport at the beginning to diving deep into complex topics and then wrapping up in a way that feels complete and meaningful. And you have to do all of that without making the participant feel rushed. So it's really about orchestrating the flow, staying flexible in the moment, but always knowing where you are in the conversation and what truly needs to be uncovered.
All right, thank you so much, Riley, for sharing your valuable insights with us today. That was truly insightful. And with that, please join me in thanking Riley.
Thank you so much. I really appreciate the opportunity to share. It's always meaningful to reflect on this work because healthcare moderation is challenging, but it's also incredibly rewarding. If today's discussion sparked even one new idea or perspective, then I'm very happy. And of course, I'm always glad to continue the conversation afterward.